I applied to a lot of programs, probably interviewed at close to 20, and it was when I got here that I really felt like this was a place where I could belong and develop my career as a surgeon.
The biggest thing for me has just been how much of a family I feel like I have here.
Because of the size of our program, everyone is important from the second they step foot in the hospital.
You walk through the halls and everyone's smiling and everyone knows who you are and knows what you like and your preferences, and you get to know who they are as people.
To have that type of environment where everyone's supporting you is just, I think, instrumental to your growth as a surgeon.
I was looking in a program for a very operative heavy experience.
My first day, my first case as a resident, I'm doing a splenectomy in a trauma patient. So that was my day one.
The ability to take on a lot of responsibility from the get-go and manage a lot of patients and very quickly get into the nitty-gritty of surgery is something that's a little bit different from other places that I had seen.
I think far and away one of the strongest things to take away from Mount Sinai South Nassau is the resident-attending relationships.
They really help you here figure out how to be your best self as well as your best self as a surgeon.
Here is something that's almost impossible to find anywhere else.
We have everything around us.
There's a beach south, there's a beach north, there's vineyards east, and there's a city west.
I think I might pick up surfing, which who would have thought in New York?
It's everything that I imagined it would be.
One of the nice things about Mount Sinai South Nassau is that it's an academic institution with a community feeling, and that's not something that's easy to get.
The newest addition to the Mount Sinai Health System is Mount Sinai South Nassau. Mount Sinai South Nassau not only offers opportunities to train in a community setting, but provides residents with the full resources of a top-tier medical school.
Mount Sinai became a great partner in this residency in providing the academic, the medical school attachment, the research attachment, help in complex cases. We have access to the Tisch Cancer Center, which is an NCI designated cancer program. So we have access to clinical knowledge. We have access to so many fellowship programs in the health system.
In our program, from day one, you're scrubbing in, you're operating. You're working with the chairman, you're working with the program director, you're working with the core faculty, you're working with the chief residents.
You will see a lot of cases, you'll have hands-on right from first year. And as you graduate, you have a lot of cases under your belt and you feel confident to go out and operate.
You're not wasting your time. And you're not waiting for a delayed gratification of, oh, someday I'll get there. You get into our program, you're there. We're training you.
You get a ton of trauma ICU, a ton of vascular thoracic, and a ton of general surgery, and then you're able to go to Manhattan, to Mount Sinai to do transplant surgery.
Doing central lines, dialysis catheters, arterial lines, those you start from day one, which is not something that happens at every hospital.
I'll have done some of the more complicated thoracic procedures that at some programs the residents may not have even heard about.
Every day is something different. You go with the surgeons to their office, seeing their patients. They become your patients.
I definitely think it's a privilege to care for patients. Surgery is very fast-paced, but it's nice to have the continuity of care, which you do get in general surgery. You know, here in our program at Mount Sinai South Nassau, we go to clinics, so we're able to follow up with these patients and kind of have some longevity there.
You learn pretty much every technique there is.
We are a small program. There's only 3 of us a year here at Mount Sinai South Nassau. We get to know our attendings incredibly well. We're on call with them at night frequently, and so you see consults with them, you manage their patients.
I never thought I would have that relationship with attendings, especially as a first year.
The investment that the attendings have for you is very palpable. They sit down with you, they ask you what your interests are, they tell you what you're good at, what you need to work on.
The biggest thing that prospective residents miss is seeing what a collegial environment we have. It's the people that make this place so special. I could not survive residency without having such a supportive group of co-residents.
It's very nice to feel like you have a home in a small community setting, but knowing that you have the weight of a name behind you.
It feels like a tight-knit family that I never thought I would have so far from home.